in an illustrative form. So in the upper left-hand corner is the number of statewide patients in the hospital being the solid line, and the ICU, the dotted line, and the on ventilators in the dash line. It's same pattern for Douglas County in green and Lancaster County in red. So you can see how at the beginning of December we were right around 600 patients. We went down to that number I mentioned before, 446 patients, right around mid-December, and then over the past 2 weeks, now back up to 602 patients statewide. And usually what we see happening in Douglas County is what we see happening throughout the state. Most of the hospitalizations over the last 2-week period have been mostly concentrated in the metropolitan areas, Douglas County and Lancaster County, but also seeing an increase in what we call our community and critical access hospitals, getting back up to a level that we saw when we had our highest hospitalizations back a year ago. And then the last slide, we always just sort of do a highlight slide for the week. And you can go to that slide that shows what our trends are. This past week, we had an increase of 86 patients. The prior week was an increase of 70 patients. We had that significant decrease of 77 and 78 patients in mid-December. Our 7-day rolling average now is at 13.6%. And you can see how the trends, we were up to 14.5% 5 weeks ago. We keep track of the number of hospitalized COVID patients that are in the ICU. That's been a very stable number. Usually it's right around 1/3 of hospitalized COVID patients that are in the hospital or in the ICU. That has trended down a little bit over the last few weeks. The number of patients, however, that are in the ICU with COVID diagnosis that are on ventilators remains fairly stable over the last month or so at right around 50%. It was 51% this past week of patients that are in the ICU that are on ventilators. The statewide number of ICU patients all throughout the state that are in the ICU that are COVID patients was at 26% this past week, and that's been fairly stable over the last several weeks to months. And then we keep track of the number of new COVID patients that are admitted per day. It was an average of 62 new COVID patients admitted per day last week.
Okay.
Much higher rates. And that's likely because of COVID, but what this
now back up to 602 patients statewide. And usually what we see happening in Douglas County is what we see happening throughout the state. Most of the hospitalizations over the last 2-week period have been mostly concentrated in the metropolitan areas, Douglas County and Lancaster County, but also seeing an increase in what we call our community and critical access hospitals, getting back up to a level that we saw when we had our highest hospitalizations back a year ago. And then the last slide, we always just sort of do a highlight slide for the week. And you can go to that slide that shows what our trends are. This past week, we had an increase of 86 patients. The prior week was an increase of 70 patients. We had that significant decrease of 77 and 78 patients in mid-December. Our 7-day rolling average now is at 13.6%. And you can see how the trends, we were up to 14.5% 5 weeks ago. We keep track of the number of hospitalized COVID patients that are in the ICU. That's been a very stable number. Usually it's right around 1/3 of hospitalized COVID patients that are in the hospital or in the ICU. That has trended down a little bit over the last few weeks. The number of patients, however, that are in the ICU with COVID diagnosis that are on ventilators remains fairly stable over the last month or so at right around 50%. It was 51% this past week of patients that are in the ICU that are on ventilators. The statewide number of ICU patients all throughout the state that are in the ICU that are COVID patients was at 26% this past week, and that's been fairly stable over the last several weeks to months. And then we keep track of the number of new COVID patients that are admitted per day. It was an average of 62 new COVID patients admitted per day last week, up from 52 patients the week before, up from 42 patients the week before that. And we also track the number of pediatric admits per week. We had 17 last week. We had a high of 27 the week before. So that's just sort of how we keep track of our hospitalization numbers and the trends. And I'll turn it over to Dr. Donahue to go into more specifics as far as how our number of cases and things like that are doing statewide. So over to you, Dr. Donahue.
Happy to. Pleasure to be back with you guys again. Thankful for the opportunity to be here and for all your availability. Since the last time we were here, Omicron spread rapidly throughout the US, and it's producing more cases than we've seen throughout the whole pandemic. This was the New York Times hotspot map from late December. And hotspots are based on case rates. So the darkest red areas are seeing the most new cases. They're seeing the most COVID-19 transmission, right? So notice the red in the Midwest and the Northeast, but not a lot of red elsewhere. And let's flip to the next slide. So this is the first week in January. You can see a lot of dark crop up for bigger cities throughout the US. Nearly every state had a signal. Omicron got into the urban environments and started spreading. Cases started increasing in the South and increase even further in the Northeast. Next slide. And this is now. So the US has not seen COVID-19 transmission like this in the 2 years we've been at it. States across the US are seeing the most cases they've yet seen, and they're breaking records. Next slide. So if we move that case data from a map to a graph, this is CDC's COVID data tracker, and we have cases in red with case counts on the left side. We've got active hospitalizations in orange with hospitalization counts on the right side. And you can see the US is beginning to see more than 1 million new cases per day. And that's 3 to 4 times higher than previous records. So the difference between the rate of transmission of Omicron and prior variants is humbling. The severity is also different. The orange active hospitalization line is clearly increasing as well, now at about 120,000 patients in the hospital with COVID throughout the US. But notice it hasn't yet surpassed the prior peak. It's close, but while case rates are 3 to 4 times as high as they've ever been, hospitalizations still haven't caught up to that previous peak. And this is what some are calling decoupling. The fact that while hospitalizations are increasing, they're not increasing like what we'd expect from previous variants. So we can be thankful for that the newest variant that's been thrown at us is less severe. But because it's reaching so many more people, hospitalizations are continuing to increase. And many states that are setting records for new cases are also now setting new records for hospitalizations too. Because even though it's less severe, it's reaching more people, and that increased contagiousness is, at least to an extent, offsetting the reduced severity. So let's look at Nebraska. This is pulled straight from the dashboard. So we have percent positivity on the left, cases on the right. We're seeing the highest percent positivity that we've seen since we started testing enough people to make percent positivity meaningful. We saw similar positivities back real early in the pandemic, but we were so selective in who was tested back then that we're already set up to have falsely high positivities. This is remarkable. So in Nebraska, between 1 in 4 and 1 in 3 people who are testing are positive. So if you're at home thinking I'm sick and I should probably get a test, chances are the highest they've been that you do in fact have COVID. If you're sick, get that test, but wear a mask and stay away from others. On the right is the case graph. So similar to the US, Nebraska now has set a new record for COVID-19 cases in one day, more than we've ever had in the past. Next slide. This is the last one for metrics I have. This is active hospitalizations straight from the dashboard. And these are COVID-19 active hospitalizations. This is not how full the hospital is. We nearly hit 1,000 active hospitalizations back in November 2020. And in December 2021, we hit a Delta peak at 637 active hospitalizations. Now we're there again with Omicron. And I know the physicians on the call will tell us about what it looks like inside of the hospitals right now. So we're asking again for your help. There are many important tools to fight COVID-19, and our sharpest tool is still vaccination. So I'm going to show you 3 analyses that look at Nebraska data and show how safe vaccines are and how well vaccines are still working, even with Omicron. So before I jump into this slide, I want to call out some uncertainty here. It's possible that as we find more Omicron and continue analyzing vaccine effectiveness, that we could see some decrease in these numbers I'm going to present. I'm not finding that yet, but we are seeing more mild vaccine breakthrough cases with Omicron. I don't expect to see any significant decrease in protection against severe outcomes like hospitalization and deaths, but it's possible we could see a drop by some small margin. We know Omicron is doing better than previous variants at evading some immunity, which is why there's more mild vaccine breakthrough infections with Omicron. However, we certainly haven't seen any drop in vaccine effectiveness yet, not for preventing severe outcomes like hospitalization and death. And that's exactly what we need vaccine to continue doing. And that's exactly what it is continuing to do. And that's this slide. This is a familiar analysis. We've shown this a couple times in the past, but it's been updated a couple ways. This is the rate of COVID-19 hospitalizations among not fully vaccinated, and boosted. So the booster part is new, and Omicron is new. Over the month of December, fully vaccinated people were 11 times less likely to be hospitalized with COVID-19. And boosted people were 46 times less likely to be hospitalized with COVID-19 when compared with people who were not fully vaccinated. So we're still seeing a huge amount of protection from vaccine, even against Omicron. We've seen a substantial increase in protection for boosted people, 46 times less likely to be hospitalized if you've been boosted. And as remarkable as Omicron's spread has been, I think this is just as remarkable. These are incident rate ratios, and these are a bit more abstract than just numbers. So we updated a visualization for another analysis as well. And that's on this next slide. This is the estimated COVID-19 hospitalizations and deaths prevented by vaccination in Nebraska. Hospitalizations are in green, deaths are in red. What we did here is we just looked at the rate of hospitalization and deaths for unvaccinated people. We looked at it by each age group because the older you are, the higher your risk is when you're not vaccinated, especially. And then we applied that unvaccinated age-specific rate to the whole Nebraska population in those same age groups. That allowed us to estimate how many hospitalizations or deaths we might see if no one was vaccinated. So the dark green and dark red are how many hospitalizations and deaths actually happened each week. The light green and light red are how many we estimate we would have seen if there wasn't vaccination. So the difference between these two lines is how many hospitalizations and deaths we estimate vaccine saved in Nebraska. And for December, an estimated 3,200 hospitalizations were prevented. An estimated 700 deaths were prevented in our state just last month. Like I mentioned before, these are just estimations. They require some assumptions, like vaccinated people are exposed at similar rates as unvaccinated people. But I think this is a valid estimation. It's simply taking what we're seeing for unvaccinated people and applying that rate of hospitalization and death to everyone. So I've talked about how well vaccine works, how well it's keeping people out of the hospital and keeping them from dying, the number of people we estimate it saved. And I think there's some people out there who might believe it works. And they're just hesitant because they're concerned about safety. We've been thinking about how to look at safety using Nebraska data. And this is my last slide. So here we looked at deaths in Nebraska from any cause. We looked at deaths from any cause by vaccination status. When we look at deaths by any cause, that includes heart attacks, cancer, COPD, diabetes, and strokes. That also includes COVID-19. It's everything. In Nebraska, we get death certificates with a cause of death on everyone who dies in the state. We took that information and broke down how many fully vaccinated and not fully vaccinated people were dying from anything. And that's called all-cause mortality. When we look at those deaths over a week, we get a mortality rate. The gray line in the middle is the overall mortality rate by week in Nebraska. So in December, about 20 out of every 100,000 Nebraskans are dying per week of anything. We found that when we split that gray line into not fully vaccinated people in orange and fully vaccinated people in blue, people who are not fully vaccinated are dying at much higher rates. And that's likely because of COVID. But what this analysis does is it shows that people who are vaccinated are less likely to die than those who aren't, even when we're not specifically just looking at COVID. So we all heard about these very rare blood clots with J&J. They're very, very rare, but they were well described. We heard about very rare myocarditis cases with mRNA vaccines. But those are all very rare, and they're absolutely not making vaccine unsafe throughout Nebraska. Vaccinated people are dying at lower rates than unvaccinated people, regardless of the cause of death. So these visuals are going to be shared through a DHHS press release. If you want the highest resolution copies, please see the press release. Those copies will have more information on them about how these analyses were completed, where this data comes from, things I couldn't fit on these slides that I'm presenting from. And I'll summarize with this. Omicron has spread throughout the US, and it is the predominant variant in Nebraska. While it's less severe, it's substantially more contagious, which is why hospitalizations are increasing. Vaccine is still working, and is keeping people out of the hospital and keeping people from dying in real time in Nebraska, and it's safe. Mortality rates throughout the state are lower for vaccinated people than unvaccinated people. And that's all. Appreciate it, guys.
Thank you very much, Dr. Donahue and Dr. Antone. We'll go ahead and turn it over to Dr. Hewlett now. Dr. Hewlett, can you talk to us about what you are seeing at Nebraska Medicine with Omicron and what you expect to see in the coming weeks?
Well, our current hospital situation, we're essentially seeing, we have about 120 COVID patients hospitalized right now at Nebraska Medicine. We have additional patients at Bellevue Medical Center as well. What we're really seeing is just increasing numbers, again, of people coming into the hospital. Some of these individuals remain critically ill. And in particular, what Dr. Donahue mentioned, the unvaccinated, those are the people who we're seeing in our ICUs. And those individuals still, even with Omicron, are coming in still critically ill, some requiring intensive care, mechanical ventilation, and in some cases, real higher level care like ECMO and things like that. So, again, we're still seeing a surge of these infections in our community, and that's resulting in a large number of individuals entering the healthcare system. I think we also have unprecedented numbers of healthcare workers who are out sick right now. And the data that's been shown thus far is showing just the surge of this in our community. And we live in our community, healthcare workers are part of the community. And so when we start to see these surge of cases within our community, we start to see individuals who can't come to work because they're ill. And that affects the healthcare system incredibly adversely, and that we have very difficult times staffing our clinical services. So even things like clinics, outpatient situations, not necessarily even just for hospitalized patients, that becomes very difficult when we're seeing this large number of cases within our community, and that carries over to our healthcare workers as well. In the hospital, we're tired. We're overwhelmed. This is really leading to a situation where we're unable to provide the care that we want to because a lot of us are sick, and those of us that are not sick are incredibly burnt out, and it's just very devastating to see on a daily basis.
Thank you, Dr. Hewlett. Dr. Vivekanandan, I'll ask the same question of you and what we're seeing at CHI Health.
Yeah, thank you for that question. We're seeing pretty similar numbers as well. We have increased amount of hospitalized patients. Like Dr. Donahue was saying, we saw a little bit of dip with the Delta when things were coming down, but with Omicron being that hospitalization numbers are going up. Overall for CHI, when I look at the data, we also have Iowa and North Dakota as well. We have over 242 patients. But like Dr. Hewlett was saying as well, our employees are also getting sick. Personally, I could tell you I have one of my infectious disease team members currently out. So, we're already a small team. So when one person cannot work, everybody's taking extra shifts, working extra hours. So it's getting hard. And I really think, making sure vaccination is the key, but also making sure that if I get vaccinated today, it still takes 28 days for the second dose to get full immunity. So get vaccinated, but please wear a mask, a good mask in the community to decrease the spread. It's really important. Studies show that wearing a mask, a surgical mask is great. If you could double mask in the community, even great. But I think that's going to be another tool that we could all do as well, vaccination and masking. Thank you, Taylor.
Thank you, Dr. Vivekanandan. We'll go ahead and jump into questions now. I had some submitted before the call from the Omaha World Herald. I'll start with you, Dr. Vivekanandan. What kinds of masks should the public be wearing now that masks are mandated again?
Yeah, very good question. Any mask is better than no mask, but if you want to wear a really good quality mask, you could buy a KN95 mask off Amazon and online, KN95, or you could double mask. So you could wear a surgical mask and put a cloth mask on top to get a better seal, or you could wear a surgical mask and get a seal around, plastic mask fitter around it, whatever you could do, but a good fitting mask so that you have source control. What I mean by that is that when you're infectious, you are expelling particles, so it catches that, right? So you don't infect others. And of course, mask also protects you. So a good mask would be really good. So you have options. If you're going to wear a cloth mask, multiple layered cloth mask, not single layer, and a good fit, but ideally a double mask or KN95 if you.
And what classifies a good fitting mask? How can you make sure that they fit correctly?
You could see when you wear a surgical mask, sometimes you have openings on the side, openings up here, below here. So you want to kind of close those openings and create a good seal around your face. So when you have a surgical mask and you put a tight fitting cloth mask on top, it kind of closes up all those holes that you have up and below on the side.
Okay, we'll go to Dr. Hewlett now, and I'm going to try to combine some questions in the chat here because I have some similar ones. Are doctors hopeful Omaha's mask mandate will impact the Omicron surge, and if so, why?
Yeah, but this was incredibly welcome news when we heard about the mask mandate. And honestly, it was almost like we were cheering in the hallway. Just hearing that we were receiving support from the health department, who is well aware of what's going on, and they've really been trying as much as they can to do everything possible to contain this kind of unprecedented spike in cases that we've been seeing in our community. My comments on the mask mandate, Dr. Huse is doing the right thing, and whether people agree with it or not, it is the right thing to do at this moment in time. Masks are just part of layered interventions, avoiding crowds, wearing masks, making sure that you are getting vaccinated. If you're sick, stay home, get tested. All of those things are all part of those layers that need to happen to really stop the spread of COVID in our community. I think wearing a mask, honestly, is an act of kindness. It's something that people can do, a very, very simple act that people can do that can not only, serve as source control, so contain, potentially infectious secretions for themselves, also protect themselves from illness out in the community. But it's something that's a very simple thing. It's something that we really all need to be doing to help protect the people around us as well as our community. It's something that I don't think people understand, that when we have these surge in cases, it's not only about the healthcare system. We talk a lot about the healthcare system, but we need to be using these layered interventions to try to continue to be able to provide other services that we all take for granted. So things like, again, we talk a lot about hospitals, but things like, imagine calling 911 and not having someone respond, or calling the fire department and not having them respond to a house fire because we have too many people out sick. These things are actually happening in states that are very close to us right now, where they've They've, declared state of emergencies because they're having difficulties because they have so many people that are sick. And so if wearing a mask is all we have to do to try to protect our community, then I think that's a very simple aspect of those layered interventions that can be done by individuals to help not only themselves, but other people around them.
Thank you. This next question I'll give to Dr. Antone. How big of a problem is the lack of bed space at rehab or nursing home facilities, and what is behind that shortage? I understand hospitals are having trouble discharging patients to those facilities to free up space.
Yeah, the main issue right now is not bed availability, it's staff availability. And as been mentioned before, is that a lot of the staff are becoming positive or testing positive and therefore aren't able to work for 5 days or so. So the bed availability is probably not the issue. It's more the staff availability. And that's sort of been the issue almost all through the pandemic, especially here in the last year or so. We are working on a program right now that we will have something in place, hopefully by the end of the month, where we will be able to have some of these patients that are needing discharge from a hospital that don't need to be in the hospital, and then we could get them to a skilled nursing facility. So that is something that the state is trying to help out with now and should be implemented here in the near future.
Thank you. Dr. Donahue, I'll ask this one of you since you have a lot of great data. South Africa, where Omicron was first detected, saw a major surge in cases, but has now seen a major decline. Should we expect a similar trend, and when do you think our peak will hit?
So I got burnt by making predictions on when we would start improving before. So Delta kind of we tried the same thing with Delta. Where is Delta improving throughout the world? And how long does it take until it starts improving? The answer with Delta was 6 to 8 weeks. So I was very, very hopeful at 6 to 8 weeks here in Nebraska, our Delta surge would turn around, but we went a bit longer than that. And then Delta came back and spiked again. I'm hesitant to apply what's happened elsewhere here, but it does look like South Africa was worsening for about 4 weeks. UK over the past several days have started seeing cases decline. And that's also after about 4 weeks. So I want to be hopeful after 4 to 5 weeks into Omicron, we'll start seeing improvement as well. But I don't take that as gospel because that isn't what happened with Delta. We didn't fit that template.
Thank you. And I realize it's 4:30, so if you guys have other obligations and need to get off the call, that's fine. I'll just keep trying to get to as many questions as I can here. Do we have any current data on Omicron in Nebraska? What percentage of sequence tests are showing up as Omicron? I'll ask you that as well, Dr. Donahue.
Yeah, I'm happy to take that one. So we do have that data. We sequence as many as we can and try to communicate those frequently. We sent out a Health Alert Network advisory at the beginning of last week saying we'd reached, I think it was 52 or 53%. We update those numbers every week. At the beginning of this week, we were at 73% of sequences that were collected within the prior 2 weeks were identified as Omicron. And that'll be refreshed again on Monday. So Omicron is predominant in Nebraska. Our sequencing always lags what's happening and what's spreading in people. If we're finding we're at 73%, we're higher by the time we update the data again. That was how we started the week, at least.
Dr. Antone, is the state considering additional restrictions because of the level of hospitalizations? What steps will the state take?
So we've had the position that when we reach a 7-day rolling average of 15% of staffed hospital beds throughout the state occupied by COVID patients, that would trigger a directed health measure. At this time, it would be, again, similar to what we did before against elective procedures, surgical procedures.
So I have a follow-up on surgical procedures that I'll just go ahead and ask you now. Are you postponing surgeries? Any idea how many, what kinds of surgeries? Some people think electives aren't necessary, but some can be serious if put off too long. And I guess that's also a question that Dr. Hewlett and Dr. Vivekanandan could weigh in on as well.
even without a directed health measure, a lot of the major hospitals now are doing their elective procedures on a day-to-day basis based on their hospital census and capacity. So that is ongoing even without a direct health measure. So the future, I don't know what's going to happen as far as whether this 15% threshold will take place or not, but that's obviously something we're keeping close eye on.
Dr. Vivekanandan, I'll give this one to you. Will hospitals be able to increase capacity enough to handle the expected surge in the next few weeks, and how will they do that?
So I think just going off of what Dr. Anton said, I think if there is a surge and if we need to increase capacity, then most likely then hospitals have to, take into account elective surgeries and procedures and then focus more on COVID. I hope we don't get to that. I hope, our community, we could all come together to continue to help us, but I am worried that that might happen. And so that is a concern, but I do think all of us will come together and all the healthcare workers do what we need to do to take care of our patients and give the best care that they need. But I am worried about increasing cases.
Dr. Hewlett, flu-rona has been used to describe a person getting flu and COVID at the same time. Is it possible for a person to catch two variants of COVID at the same time, and would they be sicker?
Well, I wish people would stop using the term flu-rona. I think, co-infection with respiratory viruses has actually been well known for a long time. We actually did see some co-infections with flu and previous variants as well. And so this is not anything incredibly new that we would have people who are infected with, with influenza along with SARS-CoV-2 or the COVID virus. As far as two variants together, none of that hasn't been proven yet. It would be very difficult to kind of say that can't happen, but in all honesty, it's the same virus. It's just two different sequences. And so the likelihood of getting infected with two variants at the same time is very low. The other issue is that when you have one variant circulating in a community that becomes predominant, like was just mentioned with that Omicron is predominant here in our community, and those numbers are probably very low, by the way, now and are changing by the day. And so those other variants just get pushed out of the way. And so the likelihood of seeing people infected with two variants is going to be pretty low. Now, what we have seen are people who have Delta, and then actually relatively soon, within a month or two, actually do contract Omicron as well. And so the people that had some immunity from Delta, it's not necessarily protective against Omicron. And so we've seen people who have had recent infections with a previous variant who have developed infections with Omicron as well. So lots of things out there, but again, it's the same virus, so you really shouldn't be infected with two different variants.
Dr. Antone, how close are we to the 15% rolling average?
This past week, we were at 13.6% on our 7-day rolling average for staffed hospital beds occupied by COVID patients.
Would I be also able to add, Taylor, about testing? I know a lot of people have been doing home testing with home antigens, and if, with the infection rate being so high, it's really important, like if you think you're exposed, likely you have COVID, doing home testing, it's okay. Instead of breaking quarantine and going and waiting in other places and trying to get tests as well. So I think if you have, there's a lot of home antigen tests as well. So if you have one available, that's okay to use. And also making appointments at other sites. But home tests are okay to do as well at this moment, those antigen tests that you have. And most likely, let's say in a home that my husband has COVID-19 and I have symptoms, most likely I have COVID-19 symptoms as well, and then isolate myself until I'm better.
Just another note on home tests. The data that we're seeing was presented on this call, that doesn't include home tests. And so there are probably a lot more cases out in the community than we're aware of. The other issue is that home tests, there definitely some utility for them, and they can be very helpful, but do know that there are some limitations to home tests as well. And so especially very early on, if you start having symptoms and you test negative on a home test, that doesn't necessarily mean that you don't have COVID, especially very early in the illness, and especially with Omicron. But they definitely can be helpful if they're positive, or if you're experiencing symptoms and you had contact with someone with known COVID, then it is highly likely that you have COVID, as Dr. Vivekanand mentioned. And so I do think there's some utility for home tests, but they do have their limitations, and PCR tests are always more accurate. That being said, I know that the availability and the turnaround time on PCR tests is an issue. And when we see these surges in our community, that will continue to be an issue going forward.
And
Thank you. And Dr. Donahue and Dr. Antone have to hop off. So thank you so much for joining us. And Dr. Hewlett and Dr. Vivekananda, do you have any more time, or do you need to wrap up as well?
I just wanted to mention one more thing about outpatient therapeutics. We do have limitations of outpatient therapeutics, especially monoclonals and other antivirals as well. So more reason that this is more reason why to wear a mask, get vaccinated, and protect yourself. So I just wanted to also highlight that. Dr. Hewlett, would you like to add to that?
Yeah, and I totally agree. The medications that used to work for the previous variants and most recently Delta don't work for Omicron. We have a very small number of medications that work to try to prevent people from going in the hospital. The issue is that we also have a very small supply of those, and all of our hospitals statewide are incredibly limited. For example, we only have a handful of doses of one of these medications that we can try to use to keep people out of the hospital, but unfortunately we have hundreds of people that would likely qualify who are immunosuppressed or kind of our highest risk patients, but we're just unable to give that medication to these people. And it's very frustrating to see that as a healthcare worker and see these limitations and just not being able to treat the patients that we want to treat. We're hoping that our supply of these medications will improve at some point, but thus far we're very limited in what we can give people. And so that is something that's different with Omicron than what we were experiencing with Delta, where we did have a relatively ample supply of medications that would help keep people out of the hospital.
Taylor, we are going to hop off. It was a pleasure being with you guys today again.
Thank you so much for your time. Dr. V, are you good to stay on for just 2 more questions? Are you okay, Dr. Hewlett?
Yeah.
Okay. I'll ask the infectious disease questions that I'm getting here. One of them was, will masking up now protect the wearer and those around them? Dr. V, if you want to take that one.
Yes, definitely. Masking protects you and the people around you. Masking, a good mask, let's say you're infected, keeps all your secretions in so you don't infect others around you. But also if you're around others, it doesn't infect you. So a good mask is really key right now. So that's why I was earlier talking about wearing either double masking, KN95, or surgical mask with a mask fitter. A really good cloth mask with multiple layers, and not just one layer, but a mask is going to be, masking is going to be really important right now. It was really, when you guys saw that map that Dr. Donahue showed, how much infection is in our community, and masking right now would really help with vaccination.
Dr. Hewlett, there's some data showing saliva tests are much more effective in detecting Omicron. Should we be switching the way we are doing mass testing?
That's a good question. There definitely is some utility to saliva tests. I don't think that that's been definitively proven yet. The issue is that most of the tests that we have available have been really tested with nasopharyngeal swabs or nasal swabs. And so we can't just do a 180 and switch over to a different way of collecting the specimens right away, because we don't know if that will really work. But there is, there is some thought being given to, should we collect a different type of specimen, but that hasn't been well established yet. But the tests that we know today, the rapid antigen test that people are doing at home, the vast majority of our PCR tests are still done using a nasal swab. And until we know anything further, that's what we'll continue to do at this time.
Okay, and then I just have one quick clarification or a follow-up to a question that was already asked. Are you postponing any surgeries right now? Just clarifying. So I think this is probably a question you both could answer. I know that it's evaluated at the hospital level for everyone. So I don't know if there's anything you could add to that to clarify or just provide a better, clearer answer.
I think as far as I know, it's evaluated at each hospital by operation. So I'm not, that's what's happening right now. So I don't have really detailed on that.
Okay, perfect. Well, I think we're already 10 minutes over, so I really appreciate both of your guys' time and everybody's time for hopping on the call today. I know we didn't get to all the questions, but thank you so much for asking them and being on the call. And I'm sure we'll see you guys here soon on a call in the future. So thank you so much. Have a safe and good evening.
Thank you.
Oh, wow, you guys. This is crazy. The numbers have spiked so high here in Omaha, where I am, that they just had a breaking news press conference to let everybody know we have to wear a mask, which I have no problem with. I always wear my mask anyway. I've been vaccinated with both of my shots. I still can't get my booster yet. I have a few more months to go. Excuse me. But you guys, we've been saying, a lot of people have been saying, keep wearing those masks, because this variant, this spinoff, the Omicron, that a lot of people try to joke around and call Omarion, as we talked about the other day. Omarion says no. Okay, he said he is not a variant, so stop calling the Omicron or Omicron. I still can't even say it right, but stop calling it the Omarion. And also, one thing I'm glad they mentioned was a lot of people is calling this the what did they say, the Rona, flu Rona or something like that. And I first heard that term on the Maddie show on T.S. Madison, and I was like, dang, is that really the name of it, the Rona flu? And I was thinking they were just kidding around. And I guess they are just kidding around. People are naming it that, though, the Rona flu, because they saying it's like a combination of the flu and the COVID. But as we listened to that doctor, she said, I hope people would stop calling it that, because it's not like two into one, but it's just one, virus. When you get it, you get sick. And if you haven't been vaccinated, you can get really, really sick. And as we see, the numbers are skyrocketed all over. And I'm glad that they're mandating masks here. I'm so glad. And I hope they do it all over. But for those of you who are watching or who might tune in later, please let me know if it's a mask mandate where you are living. Please let me know in the comment section. Please let me know about how you feel if you guys are not mandated in your neck of the woods yet. Please let me know how you feel, if you're for it, if you're against it. Make sure you like and share the video, subscribe to the channel if you're not already subscribed. And tonight at 8 p.m., make sure you come back, because we're going to be discussing the Cardi B and Tasha K trial. Is now in day 3. So we're going to cover a lot of things and look at some documents and some exhibits and things like that. So on that note, you guys, stay safe, be blessed, remain vigilant at all time. And like one of the doctors said, wearing a mask is like showing like kindness. It's showing that you care. Wearing a mask is not protecting just you. It's protecting those around you. So I know a lot of you guys don't like wearing a mask. I can't breathe. It's uncomfortable. It don't feel right. I just don't like it on my face. But it's really, really necessary, you guys. So please take in consideration other people around you. Hey, D-Cobb, you said Flo Rona. Yeah, that's what they call it. Thank you, D-Cobb, Flu Rona. But yeah, that's what they were calling it. So yeah, the doctor was like, please stop calling it that. But anyway, you guys, I'm going to get out of here. I'll see you guys again later tonight at 8 p.m. while we discuss Cardi B and Tasha K, day 3 of their trial. Goodbye.